Hey! It always frightens me.
I know, it's just like, you're live.
Bam! You're out there.
You're so live right now. Happy holidays, everyone.
Yes.
Thank you for being here.
Well, we need to welcome you back.
Oh,
because,
yeah.
you were like under the weather, totally ill.
Oh, y'all, it was
never
bad.
coming back, we thought.
It
but
was so
hey,
bad.
she's back.
I'm back.
Welcome
I'm
back,
healthy.
Kristen. That's a good place for a cheers.
Yes, absolutely. Cheers.
Cheers.
Thanks to good health.
And good skin.
They're interconnected, I feel like.
They are interconnected.
Absolutely. Well, I'm Kristen. I'm the Customer Experience Manager at Skin Therapeutic.
Yes, and I'm Brian, the guy that they let be in the videos.
Whatever. He's the owner.
Yeah, that too.
Well, today we are here to talk about a pretty interesting skin condition.
Yeah, one of the tougher ones,
Yeah.
if not the toughest.
Absolutely. So, I'm gonna get down to since we're getting down to the nitty gritty.
You're gonna take
as
off
they
your
would say.
reindeer
I'm gonna
ears?
take off the reindeer ears.
Yeah.
They're a little distracting, I feel like,
Right.
and we're gonna talk about some serious stuff today.
Don't talk about
so.
serious. You can't really do that in antlers.
No, can't do that. So
Okay.
today's live topic is melasma, and we are going to talk about what melasma is, some treatment options, and then just kind of go through the whole thing. We're going to talk about some studies that we've done some research with, and
A lot of information.
there's a lot of information out there, y'all.
Yeah.
So let's get down to it, if that's all right.
Yeah. So what about melasma have we found? It's pretty common in women.
It is, and like only 10% of men are
men
affected
have
by melasma.
That's
Yeah,
crazy.
I think men were more prone for hyperpigmentation because they don't wear sunscreen.
Because we don't use sunscreen.
Yeah, don't use
Hardly ever.
ever.
Yeah. But I should, but I don't.
But also, the darker skin tones are more susceptible to melasma, is what we found as well.
Yeah, so a lot of information. So we'll talk about, what is melasma, because a lot of times it can be confused with hyperpigmentation.
Yes.
And so we want to talk about the difference of those things too. But melasma, I'm sure as most of you know, it's more noticeable because it's more like patches. And so grayish brown patches where hyperpigmentation is typically more spotty.
Yeah, absolutely.
But melasma is not that. It's a little bit different. It's also a little bit deeper in the skin. And so once you have melasma, then that's going to be down in the dermal layer rather than just in the epidermal layer. However, when you as a licensed professional, when you're looking at somebody, you really need to know the difference between hyperpigmentation and melasma, because the treatments are different. And not only the treatment's different, but the way that you get results are also going to be different. And so we want to talk through some of those things too. So for hyperpigmentation, like I said earlier, it's a little bit more spotty, but it is typically caused by either skin conditions like psoriasis or eczema. It can also be caused by post-blemish scarring. So anything, it can be acne related. And then of course, repeated exposure to UV rays, any kind of sun damage can cause hyperpigmentation. You recognize it because it will be usually typically in spots. It is more noticeable on the upper layer of the skin. Typically is going to be on the epidermal layer rather than deeper in the dermal layer. One of the studies we looked at in an interview with Adam Friedman, who is an associate professor of dermatology at George Washington University in Washington, D.C., he describes it this way. He said, acne, sunlight, and skin rashes all have the potential to stimulate melanocytes. So those are the things that produce melanin. And it makes a surplus of pigment. And then with that surplus of pigment, basically what he says, it just dumps it into the lower level of the skin. And you kind of think of it like ink from a tattoo. That's really what it is. So when you have the surplus of melanin, then it's going to go down deeper into the skin and make these spots. And then when it's repeatedly exposed to UV rays, then it gets harder to diminish and then harder to treat. So you have to be shielding it with sunscreen, typically.
Absolutely,
always.
absolutely. I mean, we're going to drive home this sunscreen thing today.
Sunscreen.
It is absolutely important.
Yeah.
So basically what we're saying is if you see discoloration, it's probably hyperpigmentation, but before you go to treat it, you want to make sure that it's hyperpigmentation and not melasma, or so that you can get the right kind of treatment plan set up.
Yeah.
Melasma is definitely a more complicated form of hyperpigmentation. Like you said, it's deeper in the skin. It doesn't respond as well to treatments like topical treatments as well.
It takes longer.
It does take longer. doesn't do it as quickly. It doesn't respond as quickly as hyperpigmentation would to like brighteners and all that.
Right.
So what we do want to say is that treatment options. I'm gonna get my words right. Treatment options for one person may or may not work the same on another person. So if you have somebody with melasma and this treatment is working really well, the next patient or next client with melasma, it may not work. So
don't we all love a good template?
I
Wouldn't
know,
it be great just
I
to
know.
stamp with something and go, hey, this works for everybody?
It would be grand, but that is not the case with melasma. It's definitely more complicated. It is extra. It is
so
most extra.
It's
skin
the extra skin
conditions.
condition. Oh my gosh, my kids would love that we just said that. We'll talk about some treatments and stuff in a minute, but what causes melasma? So let's talk about some of the causes, and then we'll get into some of the treatments and products and stuff.
So one of the things that we found is that there's no definitive cause of melasma. There are triggers, but there's no definitive cause.
That's so frustrating.
It is very frustrating. Like you said, I wish there was a template. You could just stamp it and then you're good to go. But with melasma, changes in hormones, like pregnancy, that's why it's called the pregnancy mask a lot of times. You get these brown spots on your forehead, these patches along your cheek and chin, even on your neck and décolleté even. So it's definitely got the infamous nickname of pregnancy mask because of the change in hormones. Even birth control pills can have can trigger melasma. And then, of course, we're going to drive this home. Sun exposure. Sun exposure is pretty much a root cause of most skin conditions, this one included. So
it definitely makes it worse. That's always the
absolutely. So it's not caused by sun exposure, but it is triggered by it whenever you have repeated sun exposure and it goes untreated. So neither melasma or hyperpigmentation can be prevented or corrected without the use of sun protection. So definitely, even if you're just riding in your car, if you're riding passenger, or if you are definitely if you're outside, but most of the time we get the windows in our car, people don't think about needing sunscreen for that, what they think is little sun exposure, but you need sunscreen all the time, you guys.
Yes.
So we recommend 30 SPF or higher on a daily basis.
Yeah, that means every day, right?
Absolutely.
Yeah. Okay, that's good. Well, let's talk about just some areas that you'll typically see melasma, where hyperpigmentation you can see just about anywhere, but melasma is typically going to show up forehead, down the bridge of your nose, on your cheeks, and like you say, even upper lip and chin, but even some people have it on their forearms, their neck, their back. But it's just distinguishable because of the way that it looks. It's more of a patch rather than
a spot,
a tiny spot. And just some facts about melasma. It's so frustrating because it doesn't make you physically ill. So you don't feel bad because of melasma physically. Emotionally, however, totally different story.
Absolutely.
People just don't like the way that it looks. I mean, it's something that you want to feel like you have to cover up. And so there's often a lot of stress associated with melasma, even trying to treat it, because people, all of a sudden it just appears and you go, what happened? Where did this come from? So you've got to treat that. But also, the downside is that any kind of stress in your life too can also make it worse. Stress affects so many skin conditions and different things about our bodies, and so it shows up in places like that. So when you're working with your clients, it's important, hopefully, that they are working on stress management as well, and doing the things that they need to do there. Most dermatologists are going to recommend a combination of different treatments really to treat melasma. I don't think there's just one thing that's going to be the golden ticket to do it. It's going to be a combination of several different things. And since it is hormone related, really I would advise that your clients make sure that they see their physician to talk about hormone regulation or something like that, that they're talking to their doctor about that kind of thing, and because it can be contributing. And so you want to make sure that's managed before you go in and start doing something to treat it. We're going to talk about a couple of different studies that we found, and there's a ton of studies on melasma, but we really wanted to get into some medical journals for this one because it is a little bit more complicated and it is more of a medical condition. So on the National Institutes of Health, there's a ton of journals and studies that have been done. So we just picked out two. We're not going to bore you with all of them, but there's a ton of them out there. So one of them is called Evidence-Based Treatment for Melasma, Expert Opinion and Review. This one was conducted by a panel of dermatologists who had at least 10 years experience in clinical practice and also had some sort of academic contribution as well, and they've also had an interest in melasma. So it's a very select group of people. The second study that we were looking at, and a lot of our information comes from, is called Chemical Peels in Melasma, a review with consensus recommendations by Indian Pigmentary Expert Group. So this was actually published in the Indian Journal of Dermatology. Since melasma is very common in people with darker skin tones, we thought this was a good study too, because they talked a lot about just the risk and how susceptible people with darker skin tones are to melasma. So there's a lot of good information in that one we'll talk about.
Yeah, definitely. I think that's worth looking into. So if you have the time to go check those out, what was the website where you got these?
If you just go to the National Institutes of Health,
Yeah, okay.
there, and you can find it, or if you can just Google, medical studies on melasma.
Yeah, I think these will definitely pop up within like the first page of Google, definitely.
Yeah.
So with melasma, we need to talk about treatment options. I think that's important to understand that it is not just a, like we've said before, one size fits all type treatment option. You definitely need to have a treatment plan. You definitely need to have options. So with any treatment, you are we strongly suggest that you always do a test spot. So you need to understand how your client's skin is going to react to the treatment that you are wanting to perform to help with the melasma, and you want to know if it's going to work, if it's if they're going to be responsive to it as well. So you definitely want to set the expectation with your client that it's going to take a combination of treatments. It's not just, like we said earlier, a one size fits all for one treatment for melasma. If that was the case, this conversation wouldn't be happening. You'd be like, oh, that's easy, we got this. But there are a couple options whenever it comes to treatments. One is laser treatments and one is IPL. Lasers can be very effective in some patients. It's typically used for more dermal melasma. It has the ability to pinpoint spots and go deeper into the skin. In some patients, the laser causes irritation. It can cause hyperpigmentation, PIH, and the melasma can actually come back. So the other thing with lasers is they're also very costly. They can be really expensive treatments. IPL is another treatment option, the intense pulse light. It was shown to be effective when treating mixed melasma when combined with laser treatment. So it's just kind of like an addition to. IPL was first used for epidermal melasma and then followed by laser treatments for dermal melasma. So light therapy is a good treatment to offer as a part of an overall treatment plan, but it's definitely not a standalone thing. You have to use it in conjunction with other things. And then our favorite one to talk about is
chemical peels.
Yeah.
Of course, we sell chemical peels, but there are a lot of studies, and this is one of them, that shows how effective chemical peels are, and there's a lot of good reasons why we want to talk about them other than we just sell them. It's because that melasma can come back.
Yes.
It's hormonal, and so even if you spend the money to do lasers or expensive treatments, you're still going to have to manage it.
Yeah.
And so chemical peels fit in well as an ongoing skincare regimen to help somebody to be able to continually manage it, because even with lasers, it still can come back because you don't know what those hormones are going to do. So let's talk about some of the things that this study pointed out about chemical peels and why it works well. Of course, this is a process too, differing from hyperpigmentation, where hyperpigmentation can respond fairly quickly to any of these treatments, but especially chemical peels. This may take a little bit longer than what you want or what your client wants, but if you'll stick with it, then long term this will be a good option. It's very effective at removing epidermal melasma and also taking care of the exfoliation in there. So that's critical, because when you're removing the epidermal melasma, if you don't remove it, here's what happens. Basically, there's a transfer from the epidermal layer to the dermal layer if that melanin is left in there. And so I think it's keratinocytes of the main skin cell that are in the skin. It's most of your skin cells. But if it's just left there, then it's going to transfer into the deeper one. So what you're trying to do is if you can remove that from the epidermal layer, then it keeps it from going deeper. And chemical peels are very, very good at being able to remove that. And you can then follow up with skincare products or laser treatments if you wanted to do that, to then go deeper into the skin. And so what chemical peels also do is it takes care of the exfoliation factor. So it gets rid of all of the dead skin cells and all of the things that are in the way that can keep your brightening products from actually going into the dermal layer. Bless you.
Sorry.
That was such a quiet sneeze.
Sorry.
Wow, how did you do that?
I held that in.
Yeah, that was so good. So professional.
Oh, gosh.
So what were we talking about?
Chemical peels
chemical
and
peels
melasma.
and melasma. I think I was talking about skincare products too.
Yes, you
So
are.
yeah, it's going to clear the way for your skincare products to go a little bit deeper and really get into the dermal layer and start affecting those things. So that's when you want the brighteners to go in there and be able to do that. As with chemical peels and a lot of treatments, there is a risk of pH. And so you want to make sure that sunscreen has to be applied after you do any of these treatments. It needs to be done all the time anyway, especially with melasma.
Yeah, definitely. And just using the sunscreen that's in your makeup is really not a good thing anymore. It's not enough anymore. So I don't know if it was ever enough, but really is not enough. So we're looking for like 30 SPF or higher on a daily basis to help your skin be the healthiest it possibly can be. So melasma and hyperpigmentation have a high recurrence rate, so it must be managed with a long-term skincare plan and a home regimen. Home regimen is really important in this as well. Treatments and products should be continued so that melanin that produces melasma can be suppressed. Initial peels should be done in a series of 5 to 6, which is always recommended, 4 to 5 weeks apart. Products with ingredients shown to suppress melanin must be used between treatments along with a home chemical exfoliation. So we actually have a product called our cellular turnovers, and those are a great example of a home exfoliation treatment. You definitely need to use test spots with each kind of treatment to see how the client's skin is going to tolerate the treatment. You want to use a combination of treatments and pair peels with microdermabrasion, microneedling, dermaplaning, those kinds of things. And definitely like the dual treatments in one treatment setting. And then also peels can be used to maintain exfoliation, like you said, and boost cellular turnover rates through a good throughout the skincare plan. And then products with evidence-based ingredients should be used between laser, light, and chemical peel treatments, meaning products with ingredients that are effective for melasma. So they need to be evidence-based. So do your research on the stuff that you're using, I think is what we're saying. And then, of course, sunscreen. We're driving that home.
Yeah, have we said that yet?
We've said it a few times.
I think so. That's what I liked about these studies, though, too, is that they were very specific about products that they knew about that are evidence-based.
Yeah.
And so I'll give you some of the products that were, or ingredients that were listed in the study so you'll know what to look for. Some of these you're going to know. Hydroquinone, obviously, is probably the most popular ingredient for reducing dark spots, hyperpigmentation, but it is effective with melasma as well. There are varying strengths that you can get. Typically, anything non-prescriptive or anything is going to be 2% or lower. Anything over that, you can get prescriptions, I think, for as high as 4%. It depends, or
it's a very
some medical
strong
base.
brightening acid.
It is very strong, and it does have side effects, and so it can irritate the skin. You just need to be aware of that.
And do the test spots.
Do the testing spots. Vitamin C and vitamin E, also very effective at helping to reduce dark spots. So I think the antioxidants in those are going to play a role with those. Anything in the retinoid family, so retinols, retinol palmitate, vitamin A. I think also, tretinoin is typically prescription needed to get that one. That's a very strong pure retinol, but it will help. Some of the natural things that are out there that can help are licorice extract, kojic acid, and niacinamide. And so those are all good things to use that are known as skin brighteners. Especially if you use those in combination. A couple of ingredients too that were new to me, they may not be new to you, that were mentioned in these studies are arbutin and azelaic acid. So arbutin is known as a melanin suppressor, and it mimics hydroquinone. in the way that it works. And so it is derived from the bearberry plant, but it's also less irritating to the skin, and so a lot of people like to use that as a hydroquinone alternative. And then the azelaic acid has primarily been used to treat acne and blemishes, but it's been shown through these treatments to be effective in reducing the dark spots caused by scarring or any kind of effects that the acne brings on related to melasma or dark spots. So all good ingredients that you guys can look for.
Absolutely. And of course, we don't want to forget chemical peels. Some of the ones that they recommended in the studies were glycolic acid. It's the most effective because it is a carrier acid. So that means that if it's paired with another acid, it'll carry that deeper. It's the smallest molecule, and so it's really going to penetrate aggressively. But you need to be wary about this one depending on the skin tone and heritage of your clients. Lactic acid, mandelic, salicylic, Jesner's, and TCA were all listed as well. So that seems like a pretty broad, peels to choose from. But the reason why they had so many listed was because, like we said earlier, one treatment plan does not work for everyone, but all of these have worked on patients that they in the study that had melasma. So those were good to keep in mind, that you need to do a test spot just to see if it is going to work for your client.
Yeah. Well, and I think it goes along with what we've always said too, the power in acid rotation. That, if you can take a bunch of different options from chemical peels and products and just try some different things, rotate some things in and out during your series, then especially with this one, keeps the skin guessing, but you're probably going to get a better result long term as you're able to do this. There are some products too that we have that include a lot of these ingredients that we mentioned. One of my favorites is the Brighten All.
Yes, this is my favorite too.
The way that this topical products are rated are either combinations of 1, 2, or 3, and so that just denotes how many active ingredients that product has. So what I like about that one is it has 3. So you've got the licorice extract, also the palmitate, retinol palmitate, the kojic acid in there. So there's 3 things in there, and niacinamide. So really it's got 4.
Yeah.
So 3.5.
Yeah, I really like it. I use it on a daily basis, and I have pretty sensitive skin, and I have rosacea. I use it all over my face, even though we promote it as a spot treatment, because I've got some hyperpigmentation and acne scarring that I'm dealing with, and it works really, really well at evening skin tone. Even if you're not looking to brighten melasma or hyperpigmentation, and you have a little bit of uneven skin tone, it's really good for that as well. But it's definitely a must when it comes to melasma, and should be a part of every home regimen treatment.
Derma Boost is one of our retinol products, which is great. It has a lot of vitamins in it too, antioxidants. Our vitamin C product, which I go through by the bucket.
I know, just pour that stuff on.
I use it every day, probably more than I should. But it works great.
Yeah,
I've seen tremendous results of just long-term reducing some hyperpigmentation and different things that I deal with.
And vitamin C, I know we've talked about this before, but it actually enhances the protection whenever it's paired with sunscreen. So vitamin C will help ward off free radicals, and it helps your sunscreen work better. So it's definitely a good one to have. Yeah.
And then some of our peels that I think, of course, we have glycolic, lactic, and mandelic, but some of the combination peels are really great here. So when you start moving into Jesner's, like Jesner's Bright, the Glyco Bright or the Lacti Bright, which combine hydroquinone with some of the other acids, even in the Jesner peel, you're going to get resorcinol as well as lactic and salicylic. And the resorcinol is going to act like the carrier that's going to carry that deeper into the skin and get down into the dermal layer. So when you're using some of those peels that have the carrier with them, then that's when you can really get the good effects in the dermal layer.
Absolutely. So I know that was a lot of information all at once.
A ton.
Melasma is one of those things that they're continually doing research on and trying to find answers, because it's it's such a hard thing to treat, and it's not the same for everyone. So definitely do your own research, and just kind of see what works best for your client as far as treatment plan options. Skincare home regimen is necessary whenever treating any kind of skin condition. especially melasma. So definitely want to do your own research and look at the other stuff. But tell us again what the site that had all the studies.
Yeah, if you go to the National Institutes of Health or Google, medical studies on melasma, then you'll see the links that go into. It's a website that then houses like all of the studies.
Yeah, that's what.
And so then you can click on each study, which will lead you to more studies.
It can be a rabbit hole.
Yeah,
we found that out quickly.
It's in the Library of Congress is where all this thing is housed.
Yeah, well, that's good. So, that means it's creditable.
So that's why I like using that site, because I know that they're credible studies. If they're going to put them in there, then they've been tested and verified.
Absolutely. So just make sure you're doing your research and that you are, understand that it's a process trying to figure out what's going to work best for this particular client with melasma. And then you need to be working in tandem with a medical professional. So that has, that can be able to give medical advice or if you have a medical director, definitely want their input on this particular patient or client. So that is what we have for melasma today. We just want to remind everyone that we are still doing our free shipping on $150 or more. We are also giving away free marketing posters. And then also, of course, the volume discounts are still going on. They start at 3 of any one item. And then the big thing that we are doing in the month of December is if you purchase $300 or more in the whole month, so it's not just one order, it can be from December 1 to December 31. If you spent $300 or more, your name is going into a drawing for a complete back bar giveaway. So it includes pro sizes of all of our washes, all our cleansers, our hydrocell turnover booster, which is a super popular item, HAB5, there's like compressed sponges and headbands and just all kinds of really, really amazing stuff. So definitely want to get your name in on that. Only a few more days left in the month. But
I'll throw something else in too.
Okay.
Why not? So I'm thinking, why don't we give 10% off of Brightenol through the end of the month?
Okay.
Yeah, it's just an extra treat. Now, I have not put this on the website yet because I just thought of this. So give me 5 minutes. Don't rush out to the website and buy it. It's not there. You can call us anytime and we can do that. But we'll set that up. You've watched the whole video and everything, so we'll make that a special treat through the end of the month. We'll just give 10% off of Brightenol.
Brightenol. It's one of my faves, y'all. It's a good one.
It's the best.
Well, happy holidays. Thank you for joining us. If y'all have any questions, of course, you can email us or inquiry. I've gotten a few direct messages on Instagram about certain things, so you can still use that avenue as a way of communicating with us. Other than that, happy holidays. Have a great day.
Yeah. Thanks, guys.
See y'all soon.